You're watching Virginia This Morning. This segment is sponsored by Bon Secours.
Virginia This Morning is visiting with Dr. Andrew Vorenberg, and it says here you are robotics director, which sounds very exotic and exciting. We're going to talk a little bit about colorectal cancer today and what are the causes. So let's start there.
Colorectal cancer is the second leading cause of cancer-related death in this country. The colon is the last part of the GI tract, the intestinal tract, and it's about 3 feet long. And it can grow abnormal growths like polyps. They look kind of like moles, and they grow into cancer. And colon cancer is one of the most preventable diseases that we know of.
I was looking at a study when we were waiting for you to arrive here, and it says that the rate is going up all the time, especially for Americans under 55.
That's the concerning thing, and it goes along with what we're seeing in the clinics in that we're seeing younger folks coming in with colon cancer. And I think that actually the rates of colon cancer are dropping, but we're seeing more patients under the age of 50 or 55 that are having colon cancer. So the percentage of that is going up.
So as a surgeon, what exactly is it you do to help with this?
Well, first of all, we like to prevent colon cancer. So number one, we do colonoscopies to take out polyps before they have a chance to become cancer. But if it's gotten to the stage where you have cancer, then we go in and remove a section of colon to get rid of the cancerous portion. And we put you back together again. It's like fancy plumbing.
Fancy plumbing. Remember he said that when it's pay raise time. All right, so let's talk a little bit about the actual process of the testing and when do you start and how do you know when to start?
So for the average risk patient, you should start at the age of 50. And then you should get colonoscopies every 10 years thereafter if you don't have polyps. If you have polyps, you should be screened more frequently based on the size and the number of polyps.
And family history, does that play into the equation at all?
Absolutely. If you have a family history of colon cancer, you should be screened earlier, at the age of 40 or maybe even younger, depending on the family member that had colon cancer.
Let's talk about the options you have for screening in Richmond, Virginia.
Colonoscopy is the best option for colon cancer prevention and screening. It's the only test where you can actually take out polyps and prevent yourself from getting colon cancer. There are other screening tests and there are imaging tests, but you can't take the polyps out at the same time.
You mentioned you grew up in Richmond. You're a Richmond guy. Tell us about your background and how you got into this work.
Well, that's interesting. I grew up here in Richmond, and I was not sure I wanted to become a doctor, but had some good role models in Richmond, went off to medical school, and loved the GI tract and loved abdominal pathology. And what's nice about a colon and rectal surgeon is you can actually do these tests to prevent colon cancer and actually alter the course of somebody's life and just take part in helping build our community, build a healthy community here in Richmond.
I know you're involved with a nonprofit that we want to talk a little bit about today, too.
Yeah, Hitting Cancer Below the Belt is an organization that I started with Mindy Conklin, and it is a phenomenal organization. It's actually one of the only organizations in town that talks about colon cancer prevention. We started that about 5 years ago. We have a 5K race that we've started called the Boxer Brief 5K. And we're raising money to raise awareness for colon cancer screening and prevention.
Thank you, Doctor.
And education.
Really appreciate all you're doing.
Thank
and
you.
it is a little more complicated than plumbing, but we appreciate you. Thank you very much. And our friends at Bon Secours. And again, get that screening done if you fit in any of those categories we talked about. And right now, we'll go back to Virginia This Morning. It's important that you know the signs and symptoms of colorectal cancer. Catching cancer early often allows for more treatments and more treatment options. Connect with Dr. Vorenberg and his team at the Stony Point Parkway location. You can call 249-2465 or visit online crspecialist.com. And right now, we'll send it over to Mikey.